Hello and welcome. My name is Dr. Raj Persaud. I'm a consultant doctor and psychiatrist. I'm based in private practice in Harley Street, London. And I'm delighted to be joined today by Dr. Max Malik. Max is a very interesting chap. I mentioned to him that I'd love to interview him when I met him at a recent conference specializing in aesthetic procedures, aesthetic medicine. And I met him at this very eminent conference at the Royal College of Physicians here in London. And he gave an amazing talk. So, Max, I want to start by asking you a little bit about your training, your background, and your link to aesthetic medicine. And tell us a bit about that.
Yeah, thank you, Raj, and thank you for inviting me. I'm delighted to be here. My background is a medical doctor. I work as a consultant psychiatrist, but alongside this, over the last many years, I've also had an interest in dermatology, in faces. So I've done some training, postgraduate in dermatology, and I've continued my facial aesthetic practice for many years, and also trained as a hair restoration surgeon. So I've got two sides, which is the aesthetics and the psychiatry, which I think go well together. So
it's very unusual, your background. So this notion that we have, maybe, and I'm going to get into trouble here, I'm going to say something politically incorrect, that women's well-being and self-esteem is often much more closely linked to their appearance, in our view, society's view. And men are not meant to care about their appearance. And they say that if there's a man in the room and he's clearly caring about his appearance, that makes you suspicious about him. Is he a real man, as it were? So tell us a little bit about this link, because you straddle in a way both worlds of psychiatry, psychology, well-being, and how people look. This link between how people look and their sense of well-being.
Yeah, thank you, Rod. That's a great question. And I think, in the past, perhaps this idea that sun-beaten, bad skin, bad face, men were real men and other men weren't, I don't think that kind of holds anymore. Maybe it's never been the case, but certainly now I don't think it is. I think the reason why these two things go well together, in my opinion, is really it's all about how we feel. And you know this. Psychiatry is about how we feel. Psychology is how we think that makes us feel the way we do. And aesthetics is how we look, but of course, fundamentally, how we feel about the way we look. So really, for me, it's about that patient feeling. How about, people call them clients, but I'm a doctor and I'll still call them patients most of the time. How people feel when I've treated them, whether that be as a psychiatrist, whether that be as a face doctor or hair surgeon, I want them to feel better. If I've done a great job on the face, for example, but they don't really feel better, I don't think I've succeeded in my job. And I want them to actually feel better about themselves. And that's a journey, a psychological process, as well as simply an aesthetic treatment. I don't think doing an aesthetic treatment by itself is sufficient, really, in my opinion.
So men are increasingly, it seems, turning to cosmetic procedures. Tell us a bit about that trend, and tell us about the kind of things men are asking to have done.
Yeah, I think men are turning more and more to cosmetic procedures, whether that be non-surgical, which is what I do on the face, or, surgery, hair, skin quality. But I think the really surprising thing now in the last perhaps 10 years or so, men are having much more, the treatments are very similar now in some ways to what women have. For example, the face, looking brighter, looking less sad under the eyes, looking a bit happier around the mouth, jawline, chin and jawline, very important to men and how they appear, noses, and perhaps you'd be surprised, even lips. Men are having more and more lips done. And I think that's the kind of treatments that they have. And I think it is about how they feel at the end of the day. And that's why I think they want more and more treatment, because it's about self-confidence and, at the end of the day, human interaction. Because how we see each other instantly affects how we feel about each other. So I think that recognition is becoming more prevalent in men, and therefore the treatments are going up. And I have many men who come to see me for facial stuff, not just for hair. So I think it's becoming much more common and accepted.
What about the actual nature of the procedure? You mentioned lips. But tell us a bit more. I mean, I was reading in the newspapers just the other day, as a coincidence, that Botox is increasingly popular with men. And there was an article that focused a little bit on Simon Cowell and some debate as to whether he'd had Botox or whether it had really worked and whether he'd given up on Botox. So tell us a
Yeah.
bit about all of that.
Well, I mean, I'm not sure I'll talk about specific people, but generally speaking, these things called Botox, which are really anti-wrinkle injections. Botox is simply a trade name for one of these types of brands, a brand name, and they relax the wrinkles around the face, particularly frown, forehead, and around the eyes. But we combine them, and I combine them particularly with facial fillers, which are a non-surgical way of brightening the face and lifting and making people look more relaxed, particularly about with men. I think it's not just so much about rejuvenation, which is one aspect. It's more about a relaxed and bright appearance. And so I think that's what I think men and women want. But the way that we would treat men is very different. And I think that's the important thing, because when you look at some celebrities, men, they look feminized. Now, unless somebody actually wants that, I don't think that's a good outcome. And there are many examples in the media about so-called Botox or fillers, but people can look, for example, the cheeks can be too big. People can look like a woman when they don't necessarily want to look like that. And that is really important when we're treating men, unless they specifically ask for that, which of course some do. But men should be masculinized and not feminized unless they want to be feminized. That's really important.
So we mentioned Botox, and we'll talk a bit more about what that actually means. But can you tell us a bit more about some of the other procedures that are popular for men?
Yeah, so there's this term called fillers, dermal fillers, which I think is a bit of a misnomer, really. What dermal fillers are, they can work from the very top of the skin, which we call the epidermis, right down to the bone, to the bony layers and everything in between. So they can do skin brightening, quality of skin, as well as more structural changes, structural facial proportioning, and mimicking bone, for example, on the chin or jawline, which is very popular with men. As we get older, the bony structure of our face shrinks, but the skin remains the same or drapes differently. So if you imagine a table and tablecloth, the table is getting smaller, but the tablecloth therefore drapes differently. It looks very different and gives that aged appearance because the table has shrunk, the bony structure of our face has shrunk, which makes people look potentially sad or tired or haggard. I wouldn't use that expression, but people do come in saying, I look haggard. Can you help me, doctor? So I think that's a self-perception more than what I think.
Now, there's another interesting thing about the moment that people choose to have a cosmetic procedure. My experience, particularly dealing with a lot of women, is that there's usually a particular moment where they're highly likely to go and try something. And that's usually when there's been a major life event, very often a divorce or a relationship breakdown. And they're feeling bad. And they're feeling maybe a bit scared and a bit nervous about being single. And there are all sorts of reasons why they may be doing something. Do you find that men are coming to you at a particularly significant moment, or it's just random when they come to you?
No, I think people do come for specific reasons and significant moments. But I think that's where the consultation, Raj, is so important. You have a professional aesthetic practitioner, a doctor or a nurse who talks to the person and understands their reasoning. One of the most important things is to understand why this person has come to you now or come to me now. And if they've come because they think that my aesthetic treatment is going to revolutionize or change their life, then I would be very cautious about treating that person, whether it be a man or a woman. But if they think that they're going to gain some self-confidence, increased, feeling better about themselves, looking fresher, brighter, and then that would then subsequently impact on their relationships or quality of relationship, that is a good reason. And I think that's a good outcome. Now, interestingly, the length of time between thinking about treatment, aesthetic treatment, and getting it, research shows, is about 4 years, which is really quite a long time. If you think about 4 years, people have been looking into it, thinking about it, perhaps searching online. What does it mean? What does it look like? Because even now, there are great misconceptions in the general media. What does it mean? What does cosmetic treatment actually mean? What does it entail? How is it done? Most people don't know. The term Botox is bandied around, but really that's just not what it is. That's not how it works, really. So there's a lot of misconceptions. So the time taken from thinking first, I perhaps need a bit of freshening up or brightening up. Nobody comes really thinking they need restructuring of the face. Some people do, however, need that. It's a long time. It's a few years on average for men and women. But as I say, if men come or women come and say, well, I've just been through a divorce, I feel terrible, can you make me feel better? That's really not a good indication. That's more of a red flag, I would say, in aesthetic treatment. I would say, look, go and think about it. Go and work on, the recovery, psychological recovery from a divorce, let's say, or a major life event before you think about having treatment on your face. But, most people have had a life event, but not necessarily within the last few weeks or months. They've sort of generally had some recovery psychologically, and then they come saying, right now, I'm thinking of a new or I am in a new relationship, perhaps. Perhaps I want to feel a bit better, a bit more confident. Perhaps the woman is younger, often, not always, but I do get that. I want to look a bit more kind of that age group, so I think that's, they don't want to look odd or out of place, because most women now, well, I don't know if it's most, but a lot of women, I would say, have had treatment of one kind or another, some cosmetic, even if it's just a kind of high-end facial, they all count as aesthetic treatments, cosmetic treatment. So I would say most people have something, and a lot of people have this so-called Botox, which we would call anti-wrinkle treatment. And many people have had fillers, and many women. But unfortunately, you can sadly see in the media and on film and television people who don't look natural, don't look good. And that's true for men and women. And it's sad to see that somehow has become the norm, or what's deemed to be attractive, when it isn't. And weird looking people will never be, outside of the normal range of anatomy, will never be attractive. We know this from psychological research. We know this to be true.
Now, we were at this conference. I'm going to say something that's a bit dangerous, but you made an interesting comment to me about some research either you were involved in or you were aware of that suggests that people in aesthetic medicine, the people administering the treatments, have often had the treatment themselves, and as a result, we were walking around this conference looking at these people who are at stands, advocating or promoting or selling various aesthetic treatments, and you made the comment that these people just, on average, don't look normal. You were saying something about the way people in aesthetic medicine look. Could you, if I'm not being too provocative or dangerous, could you say something about what you said there?
Well, I think it's actually a piece of research that I'm aware of, not that I personally have done, but it seems that aesthetic practitioners, and I only deal with doctors and nurses and dentists, I don't deal with non-medical people who there are practitioners out there who, in my opinion, most of the aesthetic world's opinion, should not be practicing aesthetic medicine, who are not medical, because they are medical procedures, and you do need to know about the medical side of things. But there seems to be in many of the conferences people, doctors, nurses, whoever they may be, medical people, who sometimes have gone a bit too far and sometimes have lost a little bit of self-perception into what is attractive or what looks within, as I say, normal anatomical boundaries. So I think that sometimes you can lose insight, I think. So you do see people walking around who don't look quite right. And I think you don't have to be an aesthetic doctor or specialist to see that. Even to the average human eye, you would immediately know if something looks odd or out of place on a human face, we're instinctively hardwired through our evolutionary biology to know that. So if you see somebody with, for example, cheeks out here, you will know this immediately. It's an instinctive response to know that that face doesn't look quite right. But we, as sort of specialists within this area, can see what isn't quite right. So I think to education, public education, probably the hardest part of this work in aesthetic medicine that I do. And it's making them realize that, yes, you can certainly look younger, you can certainly look better, but there are limitations to what we can do and what we should do. Those limitations must be understood by the practitioner, the doctor, nurse, or dentist you go to, I think, before we can impart the same kind of ethos onto our patients and public understanding of what we do.
So this is a very important point. It feels to me that if you wake up in the morning coughing up blood, you don't need to be a top neurosurgeon to realize something's not normal, and you'll cart yourself off to the doctor pretty sharpish. So the realm of most medicine, what is normal, what is not normal, what is functional, what the body ought to be doing, what it ought not to be doing, is pretty obvious. In aesthetic medicine, it feels to me, and I'm interested in your comeback on this point, you're more in the realm of the arts. Do you like Picasso? Do you not like Picasso? So it's kind of like an aesthetic judgment as to what's the person is looking for. And part of your role as a doctor or the consultant or the practitioner here is quite interesting to me, because it's different to administering treatment for someone coughing up blood. You're meant to guide them a little bit in helping them think about appearance, and yet it's in the realm of the arts almost. Is that right? What are your thoughts?
I think that's right up to a point, Raj. For example, there is that aesthetic judgment, and we call it the aesthetic eye. However, and this is another thing, perhaps many practitioners, not just, lay people, don't realize that there are certain proportions, certain facts, mathematical almost, that must be obeyed for people to look attractive. So if you look at Leonardo's Vitruvian Man, if you look at his faces that he painted or drew, anatomical, why are they attractive? Because they obey certain ratios. Some of these are called the golden ratio, which is phi, and there are, without going into the numbers, but there are certain realities, certain anatomical facts that the face, human face, man or woman, must be within these parameters actually to be attractive. So what I'm really saying is there is a mathematical or a biological ratio outside of which it's not attractive. It's not going to be attractive. So we must obey these natural human evolutionary ideas, which are hardwired. I'm not making this up. This is what we actually see. So therefore, this is, evidence-based in research. It's not my opinion. Yes, so beauty is in the eye of the beholder up to a point, but beyond, the basics must be there, and the basics, we know what they are for someone to be attractive. It's not a mystery. It's been studied, and we can say this person is attractive because they have X, Y, Z in place. Now, that's true for men as well as women. For example, men must be, the sexual dimorphism that men and women display. We're sexually dimorphic as a species. We have different faces. Men have much stronger brows, for example. They have much stronger cheeks in certain chin and jawline. So when you're asking about popular treatments, men automatically come and say, I want a stronger chin or a more prominent, jawline, for example, because they know that is, in fact, masculine and it's more attractive. Is more attractive to women, but it's more attractive in perception of dominance, in perception of power. And that's, again, a psychological, a subconscious decision that when we look at people, we see, oh, that man looks strong, and that's not necessarily how big his muscles are. That's about how the proportions of his face interplay and the balance, the ratios between the different areas of the face. So yes, so there are certain facts about beauty. Beyond that, yes, then there's the aesthetic eye.
Yeah, so this is very, very interesting territory, and I think most people don't realize that, because they do think beauty is purely an aesthetic thing. Do you like the Mona Lisa? Do you not like the Mona Lisa? But in fact, as you say, evolutionary psychology says that we are designed to find certain things more attractive. Often it's operating below conscious awareness. And one of the things we are driven, according to evolutionary psychology, is to recreate our genes, procreate our genes, spread our genes around. So we are driven to try to mate with someone who fits an evolutionary prerogative, who will be helpful in passing our genes on. So one of the things we're looking for is fitness. I don't mean fit in the conventional sense of that person over there looks fit in terms of attractive. Fitness is meant in a more evolutionary biological sense, in terms of people are likely to survive in the tough ancestral environment of the jungle and be able to be fertile and be able to pass on your genes, if you get together with them, into future generations. So we've known from research that there's a link between symmetrical faces, for example, how symmetrical a face is, and the kind of development you had in the womb, and so on and so forth. So in fact, your face and your appearance is almost a legacy of biological events that have occurred to you, and is sending a message about your fitness. Now, the other really interesting point you made is a fantastic study done so many years ago about the West Point Military Academy in the USA, which is the top military academy. A lot of soldiers or people who want to run the army go there. And they looked at photographs of people arriving in the first year, and they measured how high testosterone those faces looked. Prominent eyebrow ridges, a kind of Arnold Schwarzenegger look, very, very square jaw. And the ones that scored higher on the more testosterone look, the more masculine look, ended up many years later in significantly more senior career positions. Okay. And the theory being, kind of echoing what you're saying, and it was proven by scientific research, that men who look dominant may command more dominance, and as a result, it can have an amazing effect on your career. There was an argument about whether this would apply to doctors or surveyors or solicitors or actors, whether it was military, a military academy, therefore that kind of dominance was very important. But the really interesting thing you're pointing out there is that maybe men in particular want to look a certain way because they want to have a certain impact on the world. And that is not necessarily they want people to fall in love with them, but maybe they want to be more dominant. And that's a slightly different thing maybe to what a woman might be looking for. What are your thoughts?
Yeah, I think that's interesting, Raj, and very true. In fact, that there's various pieces of research that show for example, the ridges above the eyebrows, the cheeks, the proportion of the chin to the jawline. This is called the bigone, the angle of the jaw, for example, without going into the medical terminology, the width of this compared to the width of the cheeks. All these ratios do determine, for example, how well a man is listened to, or how well a commander can work, for example, as well as how attractive women will find him. You mentioned symmetrical faces. That's really important. Basic symmetry, whether it's looking at the top to the bottom or from one side to the other of the face, is really important. And we know this from research evidence. And here's one of the interesting things: too symmetrical faces that are too symmetrical are deemed to be unattractive. So we all have slight asymmetry, all of us, even very attractive symmetrical people have some asymmetry. And in fact, that's a good thing. So one of the differences between men and women is that men with certain amount of scarring on their faces are seen to be attractive. And I'll give an example of Jason Momoa, the American actor who had got into a bar fight and had stitches, something like 70 or 80 stitches, and he's still got scars on his face. But that's seen as a very attractive masculine feature, because you can still see the scars. You can see them in his movies. But if that were a woman, I don't think that would be seen in the same way. And again, that goes back to our evolutionary biology, fitness to survive, passing on our genes. I mean, a man with some scarring is seen as masculine potentially. With too perfect skin, perhaps is not seen as so masculine, although good skin is always a good indicator of health. The light reflex is always a good indicator of health and reproductive ability. But there are these interesting differences between women and men.
Going back to the scarring on the face for the man being more attractive, the theory in evolutionary biology would be that's a man who's been in a fight, and therefore that's a man who's good in a fight, perhaps. He's a fighting guy, as opposed to one who's got no scars, as someone who runs away from a fight. That would be the theory.
That's also the theory, but also things in the old days before vaccine, for example, surviving smallpox, resistance to disease, the resistance to various other illnesses. If your skin is bright, but perhaps as a man you've got some scarring, it shows that you've got some resistance, you've got ability, you've got genetic ability to bring home the bacon. You can survive, you can fight, you can bring home the bacon, as it were. Whereas other men, weak inverted commas, that's an evolutionary term. I don't mean it in terms of societally weaker, but they're not seen subconsciously, as you say. These are not conscious decisions we make. When we look at each other's faces, men and women, or even men looking at men or women looking at women, we make certain judgments immediately, and they are mostly subconscious judgments. And I think for men, having those symmetry, strength, proportion, ratios is just as important, but they must be the masculine. And unfortunately, in the media and people who are in the public eye, you see sometimes they've got, for example, chipmunk cheeks, or they've been feminized. The chin, in fact, made slimmer, or the jawline slimmer, which is feminizing to a man. And as I said earlier, if you don't want that, that's actually a bad outcome, bad aesthetic result. So men don't really want to look feminine unless that's what they want.
So let's talk a little bit more again about the difference between men and women. My experience of doing a lot of assessments for people thinking about having, women in particular, cosmetic surgery to check there isn't a mental health problem which would lead to a bad outcome, is they've often, amongst women, it is not abnormal to discuss the idea amongst your female friends of having a procedure. I mean, you may discuss with your friends, female friends, you're thinking of breast augmentation or something like that. And that's actually considered not that bizarre a conversation. But if a man was to discuss with his male friends the idea that he was thinking of a cosmetic procedure, I think that would be considered slightly more tricky territory. So I wonder if men handle this differently, so they don't discuss it with friends, so they come to the consultation having kind of harbored it more secretly, as it were. And I wonder if therefore they're slightly more vulnerable to make bad decisions. There's a general sense in which having a conversation with your friends, if you're a woman, and they go, oh, you definitely don't need breast augmented, you know what I mean, and they talk you out of it, there's a sense in which even if they haven't talked you out of it, but they've said yes, if it makes you more confident, go for it. There's a sense in which just discussing it makes it more likely you'll come to a decision that you're happy with that will work for you in the long term. But if men are keeping it to themselves more, there's more of a danger they'll make a bad decision. What are your thoughts about that?
Yes, Raj, I absolutely agree with you. I think men, we know this, but men are much less likely to discuss things than women. And that's perhaps psychologically true as well. That's why the rate of suicide or self-harm, those sort of things are higher in men. Don't discuss things very well. We're not open to emotional sort of discussion as readily as women are. We don't have that kind of sisterhood. I think women do have that. There's no doubt about it. And they can discuss perhaps, oh, I had Botox, or I had a facelift, or I had some skin brightening treatment more readily. I've had big men, come to me, bodybuilders who want treatment on their face, but really haven't discussed it with anybody. And those people do need more careful assessment and more careful. And we do always say to people, look, go away and think about it, that time, and give them the pros and cons, give them all the options. And one of the options I always give all my patients, say, look, one option is to do no treatment. One option is always to do nothing. On the face, for example, or skin, or you can live with the wrinkles. It's not an essential medical treatment. So yes, men are perhaps less likely, and if they did have, and I've had these big guys come in who've had treatment, they would have the mickey taken out of them more in the pub with their mates, or in the gym with their mates, than perhaps women would. Women perhaps say, oh God, you look great, where did you get that done? Perhaps I can get something similar to that because it looks great on you. Whereas men will say, what's wrong with you? Why are you doing that?
Yeah. Well, what about the difference between partners, long-term partners? My experience again of this area is that women may say to their long-term male partner, their husband or whatever, I'm thinking of breast augmentation. Usually the man tends to say, you don't need it, right? But they tend to say, look, if you really want it, go and have it. Okay. They tend to kind of know that it's dangerous territory to be in terms of getting in the way of someone who maybe really wants something. But female partners of men say, oh, I want a hair transplant, or I want to do something about the bags under my eyes. I think female partners are even more likely to say, you really, really don't need it done. Do you agree? And women partners are more likely to try and be stronger about dissuading the men, and maybe not in a helpful way. I don't know. What are your thoughts?
I think that's very true. And I think it can sometimes be good that you have a female partner who's saying, look, you really don't need more hair, or you don't need to look younger. But I have seen it work the other way, as you say, where it's negative, where they really do need or would benefit from something. Let's put it that way. Need is a very, individual judgment, but improvement is not subjective. That should be universal. Your face looks better after my treatment. That should be a universal outcome. So I've had female partners stopping men, for example. Men are also bothered by looking tired, by looking, droopy, or, they want their eyes to look brighter, perhaps, their face to look a bit less angry in the frown lines. And women have, I've had that where, the female partner said, look, you definitely don't need this because you're a man. They often say that, because you're a man. But my experience is, after many years of, trying to understand people psychologically and in an aesthetic way, is that men benefit psychologically just as much, of confidence, successful in business, in fact, in work, as we touched upon in career prospects. We know this to be true, because even in business dealings, how people perceive you is relevant and to the success or not of your business transactions with people.
So now we're going to enter a very, very touchy subject, which is that in the realm of private practice, because often these aesthetic procedures, they're very difficult to get on the National Health Service. So people are going to go privately. You're going to see a private practitioner. I want to talk a bit about that journey, and what advice you would give. First of all, how to find a good practitioner, what to look for. So people are going to go Googling on the internet, and maybe they'll look for someone local. And by the way, I do think that's not necessarily a great idea. I think you shouldn't focus so much. People often say, I picked this therapist because they live near me, as if somehow that's a qualification. It's very, very unlikely to be a very good sign if you're living in the middle of nowhere and that's where the therapist is practicing. But anyway, we can discuss why that is shortly. But let's talk about the journey. People Googling, what should they look for on someone's website? What kind of qualification should they look for? Experience, other patient testimonials. And when they come to the consultation, what should they be looking for in the consultation? And I'm going to say something that's going to land me in trouble, because the reason I'm emphasizing, I think this is a very important point, I'm very interested in your advice here, is there's a lot of snake oil salesmen out there. There's a lot of people who are unscrupulous and not very good. And it's very difficult for the patient to work out who's good. So talk us through that side of things.
I think that's an excellent point, Raj, and you've made it eloquently. But what I would say is, don't pick someone just because they're local. That's the first answer to your question. Excuse me. Look at medical people. That's the first thing. In my opinion, anybody injecting your face should be a doctor, a dentist, or a nurse, and nobody else. That's my opinion, and that's the opinion of the aesthetic medical world, because these are medical treatments. You do need to know anatomy, physiology, complications, side effects, and be able to manage them competently as well. So I've actually fixed people and who've had bad treatment from non-medical people, and actually made a BBC documentary, probably taken part in a documentary about this, remedial work, as it were. So you can go to places that would be perhaps cheaper. Talking about private practice is important to say that obviously there's a cost involved in all this, and cheaper doesn't necessarily mean better, but neither does much more expensive necessarily mean better as well. Because going back to the point about people in the public eye, I've seen lots of people from Hollywood who've had bad work, and you can see them on the screen. So expensive doesn't always mean better. However, you do need somebody who's the medical person, and that means a doctor, dentist, or a nurse. You need to look at their work, what they've done previously. So you need to look on their website at before and after pictures, not just stock images. So you really want to see their patients. They should be able to show you what they've achieved with somebody's face. Obviously, we take permission from the person prior to putting the So they've all given permission. So I have people on my website that have given permission to pictures to be used. You want everybody in this snake oil, as you say, there is a snake oil aspect to this. Thankfully, most doctors, nurses, and medical people won't be heavily involved in that. I'm hoping they would be professional. And one of the things to look out for is if they say they can do anything, that's, I think, a warning, because we can't do anything. We can't do everything. So, for example, if somebody can't be helped or benefited by any of the treatments that I offer, I'll say to them very clearly, look, I cannot help you there in this situation. This needs perhaps, I don't know, a plastic surgeon, let's say, or something else. Or the treatment isn't appropriate because of the psychological reasons. So I had a lady fly in once a few years ago to see me in Harley Street, and she said, oh, I've been looking, she came from Dubai. I've been looking, you're the doctors who really helped me. You're going to be my savior. And when people say things like that, it's really a red flag, So I didn't do any, I'm not that kind of person who is world famous. So I know that what she's saying is there's a psychological reason there. She's saying this. So I referred her for some psychological therapy. I didn't treat her face because, in fact, that's not what she needed. So there are examples where we must say no, and it's important. It's not about money. It's about the best interest of the patient, the person. We have to say, no, I can't do this, or this would not suit you. And there are many examples where I do say no. Medical qualifications. I'm a member of British College of Aesthetic Medicine. That's an organization for doctors, which has an entrance sort of exam, if you like. And people who are members of that have a fairly good chance of them being good practitioners and giving you good, honest advice and outcomes. So the British College of Aesthetic Medicine is an important body in aesthetic medicine. If you look at everybody, unfortunately, says they're all advanced practitioners here in this world, which is, you say, very different to somebody coughing up blood, or if you had high blood pressure, you'd think that all doctors have, who are treating you would have that basic qualification. In the world of aesthetics, it's not just doctors who are doing these treatments or nurses. A lot of lay people doing these treatments, they don't necessarily have the qualifications. You can end up with serious problems, and it can be very significant, the impact psychologically and on the person's face. So look at the length of time they've been doing this, look at how much practice, look at the qualifications, and I would strongly say anybody chooses, they must have a medical qualification, ideally with further qualifications in this area, and they'll be able to evidence what they can achieve or do. And so that's the important thing, because, for example, if you go to buy a car, you go to a Rolls-Royce showroom, you know what you're going to get and you know what you're going to pay. If you go to buy a Mini, you know what you're going to get and what you're going to pay. And everybody knows that. But because the world of cosmetic medicine, aesthetic practice, not regulated to the same degree, and the knowledge of the general public is not as obvious as it is when you go to buy a car, you can sometimes be misled into thinking that this person who doesn't have medical background can achieve the same things as somebody who does have the medical knowledge and experience, and the reliability, professionalism, the follow-up, for example. All these things really matter. And I would say before doing, trusting your face to somebody, really do your research, homework, take your time. And that's another red flag. If somebody says to you, right, come on now, we're going to stick something in you, don't have treatment with them, whoever that is, because there's never any rush for these things. They're elective things. They're not emergency procedures. You can take your time, you can think about them. You can ask as many questions about the person as well as about the treatment, and that person should be able to answer you competently and reassure you. And if you don't feel reassured or don't feel happy, and also they should be available to follow you up. That's really important after the treatment. And that again comes back to the professionalism that medical people will have. So these are some of the things I would say. It's not just about price, but it's not the cheapest and it's not necessarily the most expensive either. It's knowing who that person is and trusting them to do that for you.
Yeah, so I want to pick up on some of the things you said. I think the point about price is extremely important. The consumer who doesn't know anything, unfortunately, uses price as a guide to quality. And we
Mhm.
both know that's very dangerous indeed.
Yeah.
Now, the other thing is they look for other guides to quality, which are a bit dodgy. I mean, I work in Harley Street. Harley Street's got a very famous name, but there's a famous saying in medicine, Harley Street is an address, not a qualification. And a lot of people don't realize that, okay? So beware of one of the things, all the things you think are a guide to quality may not be. Now, another thing is personal recommendations by another patient can be quite powerful, but I'd be a bit careful about that because that patient only has one set of personal experiences. It's better than nothing, but I would be careful. A recommendation from another doctor, a qualified practitioner, a GP, etc., I think is much more powerful. And I'll tell you one of the reasons I think, and I'm interested in your opinion on this, because it's not the reason most people think. I mean, I know you, Max, and I would definitely recommend you to anyone who came to me seeking a procedure. I have enormous respect for your practice. Now, let us say, and I know this wouldn't happen, but let's say they went along and they weren't happy with you, then they could come back and I'd have a word with you. I say, look, Max, that guy I sent you the other day wasn't happy, okay? And that person has a back channel of ensuring quality because you will, if I have a word with you, you will see
Mm.
them again or whatever, do your best to try and fix the problem. So that's
Absolutely.
another reason why professional interreferral is extremely important. You have a power once
Yeah.
someone like me or a doctor's referred, because if you're not happy, that doctor who recommended you will have a word with you to try and fix
Absolutely.
it. What are your thoughts about that point?
Absolutely, that's an excellent point, and not one that many people necessarily think about. But having that, I suppose, quality assurance, if you like, from the doctor is really important. And another example would be like many of my patients are actually doctors themselves. You know, professionals, consultants in various fields of whatever medicine, and uh, and specialists in their own right. And the fact that they would recommend or trust me is a great,
Yes, I
I
agree.
think,
Yeah,
indicator that
yeah,
hopefully I'm not going to do things that look weird or and
yeah,
definitely, you need somebody with experience and knowledge to be safe. Safety is number one, because this
yeah.
isn't like getting your nails done.
Mhm.
At worst, your nails might get a bit damaged, but the risks of bad aesthetic or cosmetic practice and outcome can be really
Yeah,
serious, including, loss and death of skin, potential blindness, other problems, infections, etc., etc. And you need that high level of medical practice to ensure that those are minimized and the serious complications never happen. The serious complications should never really happen in a good aesthetic medical person. For example, blindness. I mean, yes, it is a potential complication. I don't want to frighten people, but it's not something that should be happening on a regular basis. People who are competent and able to do this. So those, although in the right hands, what I would say, right, these treatments are extremely safe, extremely low risk, and extremely effective in the right hands. So that's what the public education work is all about, getting the right person to do the right treatment.
Yeah. Okay. But I still want to stay with this point because I think it's very important about how to know. Now, what about the actual setting of the consultation? Although we've both said that don't beware of price, I think it is the case that people who are successful practitioners will tend to have a certain kind of clinic. You won't be seeing them in their living room, for example. They will be in an obviously established clinic that looks busy and looks successful, and they'll be in a city center or somewhere where, let's say, it's quite expensive to rent, and that's a signal that their work is so
Yeah.
successful that they can pay rents and high rents, etc. Now, having said that, the consultation fee is not a good guide. Pay attention to the setting in which you're seeing the practitioner. If you're seeing them in their living room, that's probably
Yeah.
not a good sign. What are your thoughts?
Absolutely, Raj. I couldn't agree with you more. I mean, if somebody offers to come and do it in your living room on your kitchen table, that's immediately a red flag. Don't let people touch your face on the kitchen table. That's I mean, and yes, in the city center and in a prominent, obvious location with a medical setting, with a medical clinic that looks and feels medical. Yes, you're coming for aesthetic treatment, but you're coming to a professional doctor or nurse. So therefore, it has to be medical. has to meet those quality standards. Many clinics are CQC registered, and you can look at them online at CQC registration. Not all clinics that do just, for example, anti-wrinkle or fillers need to be CQC registered. So not everybody needs to be in this world. Although if they do certain procedures, they do need to be CQC registered. So if it looks medical, it feels medical, it's professional, and everybody in the clinic is professional, it's in a prominent location, and you feel not pressurized into doing anything when you go into the clinic, I think that's also an important factor by staff or by the medical people there. You should never feel pressurized or rushed into doing anything. I think that's really important.
Now, another point I want to focus on a bit is the nature of the consultation itself. And I think you should beware of people who gallop to the procedure. You've already hinted at this point, but I want to just develop it a little bit further, because in psychiatry and psychology, people often go, and the sign of a bad consultation is within 10 or 15 minutes, the practitioner is offering advice, is saying, you need to do this, you need to do that. What you want to see is a practitioner ask you a lot of questions about yourself, and they're trying to get to know you as an individual, and they're trying to figure you out. And then at the end of about 45 minutes, in my consultations, which last an hour, at least 45 minutes is spent asking them a lot of questions. And it's only the last 15 minutes that we get to the advice. And people have often expressed surprise because they say, I asked a hell of a lot more questions and before they got to the advice. And they don't realize that anyone who's getting to the advice very quickly, that's dangerous, because it shows, amongst other things, they're just there to hand out the procedure as quickly as possible. They're like an assembly line. Whereas if you ask lots of questions, you're trying to figure out what is in the best interest of this person. And it may well be, after all the questions, you think actually the procedure isn't right for you. So lots of questions before you gallop to the advice is a good sign as well, in my opinion. What are your thoughts?
Yes, I totally agree with you, Raj. I mean, lots of questions should be both ways. So lots of questions from you as the person going to see the doctor, and lots of questions should be asked by the medical professional seeing you. It shouldn't just be, oh, you want this done, right, jump on the table, I'll do it, and off you go within 10 minutes. That's another, I think, not a good sign, a red flag. I mean, as doctors, medical people, we're all pushed for time. However, I would say to the general public, if you feel rushed in any consultation, in any decision, don't do it. Don't go for it. If you feel rushed, if you feel you haven't got all the time you need to ask all the questions you need to ask, and that person hasn't asked questions about you as an individual, so about your life, about how you think, you feel, not just the usual medical question, do you have any allergies, or, are you on medication? Those are the basic questions that any medical person will ask, but also the rest of it. What are you trying to achieve? What are your hopes? What are your aspirations? What would you like to not only look like, but what would you like to feel? Why are you doing this now? Why now? These sort of things. Where would you like to be in 6 months, in 1 year? Because it's that journey. And we know this psychologically, being a psychiatrist, the journey is what really is the long-term therapeutic outcome. The feeling good factor is not going to be a one-hit wonder. It's going to be that journey. I mean, no matter how good you are, one consultation, one treatment can't do it all. It's impossible. So if developing that trust to be able to go back to that person time and time again, and knowing that that person will not do something for you if it's not right for you. So taking time, and that medical practitioner should be interested in you as a person, your social circumstances, your lots of things about you, and those questions should be both ways. So I also have forms screening. Usually they fill in before they talk to me, so I get an idea already, and all the basic information. But then I want to know them as individuals, because I do want to, it's a bit of a cliche, but I do want to individualize that treatment and what people think is a priority. So people often come in saying, oh, my nose, but really it's not the nose at all. So we have to, as medical practitioners, professionals, guide them, saying, well, this is what you really might help you, or what you really might. So that is even more important, really, because you could do just what people ask, but sometimes if we're not aesthetic experts, we don't really know what's best for us. And that's where that trust and that, the journey comes in. It's a long-term goal that we're looking to look fresh, We want to feel good on a long-term basis.
Okay, so we're running out of time a little bit, but what are the best aesthetic treatments in your opinion for men?
Well, I think let's look at what makes men look not good. Let's think about that. So, for example, angry men. I don't think looking angry is a good look for anybody, whoever they are, whatever they do, because that's going to impact on people's perceptions, relationships, work, definitely, and private life. So, for example, if somebody's got very heavy frown lines and very heavy wrinkles around the top of the face, then those sort of things are off-putting, I think. So we can sort of help that with anti-wrinkle treatments, as well as certain specialized type of treatments like fillers, for example. Equally, under the eyes, the deep dark circles, the tired look is not good, and that can certainly be helped. All of these treatments I'm talking about are without surgery, so there's no surgery or cutting involved in any of these. Similarly, the nose to mouth lines or the droopy cheeks, these are things that make people look heavy, and the thinning of the chin, the narrowing of the jawline, proportion and balance, as well as looking fresh. I think the men go for those sort of treatments. But also what I would mention is skin quality, because we talked about health, Raj, looking healthy. And your skin is a really good indicator if you look healthy or not. So things like medical quality skin care treatment, which I always advise about, alongside the structural work, and those combination, it's always about, so there are lasers, there are obviously all these devices that can be used, all sorts of things, radio frequency, lasers, things, energy-based devices, we would call them. But actually, they may be suitable for some people, but they may not be as well. And so that is the real, and what a good practitioner should do, discuss the pros and cons of each treatment option, as well as things like if surgery would ever be appropriate or not, as well as the minimum treatment and what we can expect, realistic expectations, I think, very important. We can achieve a lot. We can achieve a lot now without surgery. Really, I think that's really important to say, as well as the negatives, the positives. You can actually achieve a great transformation in people's lives, in quality of life, as well as how they perceive themselves by non-surgical methods. So the positives are really, really there, as well as the negatives. And that's what's rewarding, I think, about what I do, because it really is about quality of life outcome. It's, you feel better, and hopefully your relation, I can't fix people's lives. That's not what we're doing here. I'm not trying to, I'm not working as a psychiatrist, or I'm not working, it's an aesthetic doctor. But if you feel better and you have that journey of feeling better, then obviously it will reflect in every aspect of your life. So I would emphasize the positive as well as the risks and dangers.
So I want to talk a little bit about the link between looking better and they end up feeling better, because I think there's a mistake that many people make who are looking or chasing down cosmetic procedures, and you talked about unrealistic expectations. I think, in my opinion, and I'm interested in your opinion, and the way this works is that if you feel a bit more confident in yourself, and you feel better in yourself because you've had a procedure and you think you look better, then you go and do more things. You go out more, you socialize more, and also you act in a more confident manner. And it is that action in the world that then leads to better outcomes, right? It's the mediating variable is the action in the world bit, and the looking better is the beginning of the chain of events. The mistake many people make is they think, if I look like Angelina Jolie, then I will end up having her life. No, what has to happen is if you look a bit like her, then you have to act in a different way, and it's those actions in the world that will make a difference. And that bit, that hard work bit of how you have to act differently, is the bit where people fall down, because they don't understand that is their responsibility. They often believe it's the practitioner, your position, your responsibility to fix their lives, because you will fix the way they look, and then you will magically fix whatever's going wrong in their life. What are your thoughts about that?
Yeah, I think that's a really important point, Raj. I mean, it's like, excuse me, buying a really expensive car will not fix anyone's life. It's the same thing. Looking better won't fix a life either. But as you say, if it makes you feel better, and you feel that your human interactions, your personal relationships, your business interactions and relationships, that, and then the effort you must make. And that's why I try to give a little bit of motivational psychology to people who I see, because to try to, give them that confidence to act differently, because surely it's the actions then that will bring about the change. The behavioral change that we enact will bring about the change in the quality of our lives. And that really is the key. I can make people certainly look better, but I can't make them behave differently unless they want to, and they engage in that process of, for example, somebody who isn't socializing, isn't going out or engaging in successfully in their work or career. They have to be willing, as we know, they have to be willing and wanting to do that for us to help them to do that. So looking better is only part of it. Wearing the same clothes as Angelina Jolie or Brad Pitt won't make us, unfortunately, look like Brad Pitt. But it's the positive, it's the decisions and the actions, and that is the key to understanding how this can help. It's part of the jigsaw. It's certainly not an answer to anybody's problems.
So you see a lot of men who are coming to you for consultations over cosmetic procedures. Now I'm going to ask you again a tough question. Do you think these men are in any sense psychologically different to the average man? Or in what way are they different? So the classic theory 20, 30, 40 years ago would have been these are more narcissistic men. These are men who are more in love with themselves and a bit self-centered. But I'm not sure. I mean, that would have been the stigma 30 or 40 years ago. My experience of seeing a lot of women pursuing cosmetic procedures is they're not more narcissistic. And if anything, they're just more confident and more assertive, and they decided they want to make a difference. But what are your thoughts? Is there a psychological difference between the men that come to see you and the average man, would you say?
I would say the psychological difference, Raj, is in as much as they have more insight into their parents and how their parents can affect their lives. So the insight is the difference. And we know this is so important in psychiatry, but it's also important in aesthetic medicine. If a man comes saying, well, I'll look better, I'll look brighter, let's say, with less tired eyes, or I'll look more confident with a better nose, let's say, and that will then enable me to do the things that I want to do more confidently. That is the difference between, I'd say, the average man and the person who comes then to have the treatment, because they've gained that insight into what the treatment can do for them. Whereas women are slightly different. Women would have slow social acceptance from their peer group, their subculture that they inhabit. And I think that would be slightly different. Of course, they want to be attractive, and, that's all true. But men don't have, as we've sort of touched upon, the same brotherhood as women have, the same sisterhood, I think. And that's a problem, that men aren't so forthcoming. But when they come to aesthetic treatments, I think having that insight of how it can make a positive impact, not on just how they look, but how they think, and therefore how they feel. So that look, think, feel is really the process that I try to take them through.
So again, I'm going to ask you a very dangerous, very politically incorrect question. In my view, and I see a lot of women, partly because of my interest in eating disorders, so I see a lot of supermodels and actresses, and many of my male colleagues burn with envy the appearance of my waiting room at times. But I think women, because appearance and they're bombarded with media images much more than men are, women, going back to your point, have more insight in terms of how they look and their appearance compared to other women, and the impact on the world compared to men. So I think there's this famous, terribly very sexist scale of 0 to 10, where 10 is a very hot looking woman and 0 is not a very hot looking woman. And you can score yourself on this scale, and people can score you, and a lot of very, very awful social media around that. I think women have a much better insight of where they score in terms of how other people evaluate their appearance. And they may be more resigned to it, but they know where they score, generally speaking, right? They often lack self-confidence, so they may give themselves a slightly lower number than maybe other people might assign them, but they're not wildly out. We are rapidly running out of time for this question. I think men are completely adrift in terms of scoring themselves. What are your thoughts?
Yeah, I think there is research to show that, well, men and women, but particularly men, are very bad at judging how they look, how they, a lot of men might think, well, they look all right, but they actually might look very tired, or they might describe themselves really, or their friends close friends might describe themselves as looking, a bit haggard or, tired really. And I think they're gaining that insight. And the other problem is they don't know what can be achieved or what can be done. And I think that's where women are more clued, more switched on. Women in their magazines and their social media, etc., they get these things all the time thrown at them. Cosmetic this, cosmetic that. Whereas men don't really, they don't know that something can be done relatively easily without surgery.
Max, I'm going to have to interrupt you. I'm really sorry. We're completely out of time. But many thanks indeed for talking to us. Dr. Max Malik, you can find him on the internet. Look him up. Thank you very much, Max.
Thank you for having me, Raj. Thank you.